Taylor Hendricks of the Utah Jazz suffered a very gruesome looking leg injury in tonight's game that was severe enough for him to be stretchered off of the court. Here's what we know so far. The Utah Jazz official X account ruled him out very quickly with what they are classifying this injury as being an ankle injury, and other sources are describing this injury as an injury to his ankle/foot. So with today's video, what we're going to do is we will go over the injury replay, we'll talk about the relevant anatomy for the structures that could be affected here, and we'll go over some injury possibilities. Ladies and gentlemen, welcome to my channel. If you're not familiar with me, my name is Nick Gallo and I'm a doctor of physical therapy. And with my channel, I take a look at sports injuries and I explain them so that they're a little bit easier to understand. I'll also go over the pertinent anatomy and talk about what that person should expect when coming to rehab. If you enjoy this sort of content and you want to see more of it, please hit that thumbs up and subscribe to this channel because I will be making more of these videos in the future regarding sports injuries, rehabilitation, and other physical therapy related content. Also, if you have any comments or questions, please leave those in the comment section below. Now we see here on the injury replay that as Hendricks is running down the court, he is going to slip or trip, something that's going to create a fall. And as he's going to do this, he's going to fall on that right leg very awkwardly. Here I've got my model of the foot and ankle joint. And so the ankle joint is actually formed of two long bones that are going to come down and form either side of it. This first bone is our shin bone, also called the tibia bone, that's going to come down and form this inside piece known as the medial malleolus. Then as I flip the model to the outside, we have our fibula bone that's going to come down and create this outside piece of the ankle known as the lateral malleolus. And on the inside here, we have our talus bone. These articulations together form what we know as being the ankle joint. There are four main motions that are at the ankle joint. The first one is being dorsiflexion, where the foot is going to be bending back towards the person. The opposite of that is going to be plantar flexion, where the foot is going to be pointed downwards. Then as I flip the model this way, this motion coming inwards is inversion, and the opposite of that is going to be known as eversion. As we take a closer look on the injury replay, as Hendricks is falling to the court, we see that his foot is greatly going to be in external rotation, going the opposite way that the leg is actually facing. And you can see on the model that as I do this, this is putting extreme strain on those tibia and fibula bones. If the force is great enough, you can see that that talus bone essentially pops out of the joint here. And this is usually accompanied by a fracture, whether the fracture be in the medial and or the lateral malleolus, or sometimes even further up the lower leg. As of right now, we don't know specifically whether he has suffered a fracture and or an ankle dislocation, but at the end here, we see that as he rolls over, the foot and ankle seem to be facing the incorrect direction, which would be consistent with a dislocation. So immediately looking at the injury replay, I think he's definitely at risk for an ankle dislocation / fracture, whether that fracture be to one of the malleoli here, or it can also happen to both of them, or that fracture be slightly up the leg. It really just depends on the actual location. There are some soft tissue structures that are very at risk in this extremely externally rotated foot position because the separation of the tibia and fibula bones stress the ligaments that are known as the high ankle ligaments. We have one on the front and one on the back. The one on the front is the anterior tibiofibular ligament located right in through here. And on the back, we have the posterior tibiofibular ligaments. Basically, these ligaments function to prevent any sort of separation between the tibia and fibula bones. And as you see the model here, once again, any sort of external rotation movement that gets excessive is greatly wanting to separate those two. Although as of right now, the primary focus seems to be on that lower leg and the ankle. One other joint that is absolutely at risk for any sort of injury in this case is going to be his knee joint, because as we look on the injury replay, once again, he is getting a lot of twisting and rotational force going through that knee with that foot being in that externally rotated position. As I put a lot of rotation through this model here, it wants to stress all of those major ligaments. It can also potentially damage the meniscus. So what's going to happen in this case is he is absolutely going to be having an x-ray so that they can tell what sort of damage has been done to the bony structures. Then after that, he's going to have an MRI so that they can essentially see what soft tissue structures are damaged in this case. So they will rule it out in the ankle, and then they will hopefully rule it out in the knee. Depending on where the fractures are are in an ankle fracture dislocation, that's going to be where the hardware is going to be placed, obviously, because you want to make sure everything is nice and stable to create an optimal healing environment. There are times where it is just on one malleolus, it can be both. It really depends on the severity, and obviously that's going to be determined by the advanced imaging. Then, as I've done more advanced imaging to essentially look at the soft tissue, they're going to grade the severity of these ligament injuries. There are grades 1, 2, and 3, where a grade 1 ligament injury is where you're getting essentially a little bit of micro tearing to the affected ligament. In a grade 2, this is where you're getting something known as a partial tear. And finally, in a grade 3, this is where you're going to be getting a full rupture of the affected ligament. Depending on the severity of the ligament injury, that can also lead to a surgical intervention. It really depends on how that person is presenting. So if I happen to hear any updates regarding his case, I'll be sure to update everybody in the comment section. Also, if you happen to hear anything, please feel free to update us as well. Thank you so much for watching my video today. If you enjoy this sort of content, I'm going to go ahead and link one of my playlists so that you can watch some of the videos that I've talked about in the past. Thank you so much for tuning in, and I'll see you next time.